Knock, knock, knock.
Come in.
Hi, my name is LaShawn and I'm going to be your nurse for today. But what I'm going to do right now, we're going to do a head to chest inspection, and this test probably going to take maybe 20 to 25 minutes. What I will be doing, I will be gathering some information so I can record it and give it to the doctor. It's going to entail, I'm going to check your lymph nodes, I'm going to check, I'm going to check your head, I'm going to check your eyes, your mouth, your nose, and your ears. And I'm also going to listen to your chest and listen to your anterior and your posterior chest, and then we're going to listen to some lung sounds, okay? Before we get started, do you know, you have like a family background, know any history in your family as far as any type of heart diseases or anything?
No, ma'am.
Okay. I'm going to be asking you some questions throughout this assessment, okay? But first, before we start, I'm going to need two patient identifiers. Could you give me your name and date of birth?
Kyle and Andrew Donaldson, March 23rd, 1999.
Okay, thank you, Mr. Donaldson. And I will start off by I'm going to assess your scalp. That means I'm going to touch your head. Is it okay if I touch you? Okay. Well, I usually have gloves on, but I'm going to touch your head. And what I'm actually doing here is I feel in your head to make sure that there are no lumps, there are no lesions or any deformities. I look in your hair. There are no infestations in your hair. The next thing I will be assessing is, well, I'm looking at your head and I see that your head is in the midline of your body. I'm looking at your eyes and your nose and your ears. Your eyes are symmetrical, your ears are symmetrical, then your nose is in the middle of your face, so that means it's in the midline. Now I will be assessing your eyes, and by doing that, I'm going to be pulling down the bottom of your eyelids, and I'm going to be looking at the conjunctiva, making sure that it is clear and it is white. I see no discharge or drainage coming from your eyes. I see no swelling to your eyelids, so I'm going to check your eyelids, okay? I'm just going to look here, and your sclera and everything is white. I'm going to use my pen light, and with this pen light means I'm going to shine the light in your eye, and I'm going to be assessing the reaction of your pupil to the light. This one here is like an indicator of how big it goes from 2 all the way up to 10 of the size that sometimes the pupil will dilate. So I'm going, and then after I do that, I'm going to ask you to follow. Can you follow the pen? I'm going to follow it to the left, and then I'll ask you to follow it to the right, okay? But first we're going to do the following. So I'm going to ask you to look at the pen, and then go this way with both of your eyes and come back. And then we're going to go this way, then we're kind of back. And I'm going to shine it in your eye. And check the reaction of your pupils. Okay, next I'm going to touch your ears, okay? And I'm going to be checking the meatus of your ear to make sure that you, no swelling, no drainage. Do you work around any loud noises or anything?
Mm-hmm.
You do? Okay, is there any history of hearing loss or deaf or impairment in your family? So how does the sound that you work around, has it impaired your hearing? Does it cause you to have, like, sometimes you have to turn your TV up a little louder in order for you to hear it?
No.
Okay. And what kind of environment, what kind of industry do you work in?
Warehouse.
In the warehouse? Do you wear ear protection?
We wear headphones to listen to the one we talk to us, but like it's not.
Okay. And I have another question. How do you clean your ears?
With a towel.
With a towel? Okay, yeah, because it's very important that you don't introduce anything into your ear canal. So yeah, clean it with a towel, just going around inside the ears. I'm also going to check the back of your ear to make sure that there are no open areas back there and that the skin is intact. Then I will be checking, I'm going to check your nose. As I'm looking at your mouth, I see that your mouth is pink and it's moist. Can you smile for me? Okay. Can you open your mouth? And when you open your mouth, I'm going to be checking your uvula, and I'm also going to be looking in your mouth to see that the color and the moistness of your buccal mucosa to make sure that you're hydrated. Can you open up? I don't see any cracks in your teeth, no broken teeth. Can you stick your tongue out for me? Okay. Now I will be assessing your nose. In assessing your nose, I'm going to ask you to use one finger and blow on the other side in and out for me, and do the other side. So I was checking for patency to make sure that there isn't any blockages or anything like that. See, no drainage. Your nose is in the middle of your face, so your midline. It's midline. Then I will be assessing this here. Right here are your preocular lymph nodes here. And by assessing this, we're checking for swelling. And what that does, what your lymph nodes do is they drain. So we're checking here to make sure that there is no swelling to those lymph nodes. And those are your preocular. And this back here are your postocular lymph nodes. Okay, nice. Now I'm going to assess your neck. And I'm going to be assessing for range of motion. I need you to turn your neck to the side, to this side, and I'll turn it to this side. Any pain when you do anything like, can you flex it and extend it? Any pain to your neck area? Okay, I'm also gonna check here. These are your jugular gastro lymph nodes. These, and these are your submental. So I feel no swelling or anything there. And these, check your carotid. One at a time. Okay. Now I will also be checking your breath sounds. I'm going to ask you to take a couple deep breaths for me, and I will be listening to it with my stethoscope. So, these things are hard. Okay. And I will be using the diaphragm of my stethoscope, and I'm going to check here in your aortic valve. So take a deep breath. Okay. Your pulmonic valve. Earth's point. Your tricuspid. Fix your shirt here. And then your mitral valve. Okay. To see that you're not using any of your ancillary muscles as you're doing that. I'm going to check your posterior chest, and I will also be checking your lung. Your left lung and your right lung. And the 2 lobes of the left and the 3 lobes of the right lung, okay? I should take some deep breaths for me. I'm going to start up here. Excuse me. Take your time, you don't have to rush to take your breaths. 5. Okay, on this side I will be checking your left lower lobe of your lung, the upper and lower lobes. And over going to your right side, I'm going to check your right upper, your right middle, and your right lower lobe. Okay. Your breath sounds are clear and even. I think that that may conclude my assessment. All the information that I have gathered, I will be writing down and giving to the doctor, and he will be in with you shortly to speak with you, okay?
Appreciate it.
Thank you.
And scene.